where your ribs are going to articulate with your spine, which is why we were talking about the importance of posture and movement of your scapula and rib cage. And then this little offshoot that goes straight back, like a little fin behind you, is your spinous process. And so these are the ones that stick out, that you can kind of see, like you said, like as a dinosaur through the skin, right? And then on this picture you can't see it, but these are stacked on top of each other, and then in between each of these are where the intervertebral discs are going to be present. So this is a lumbar spine instead of a thoracic spine, but you can see these little discs are going to be kind of sandwiched in between them.
And a lot of the lumbar spine has similar features to the thoracic spine, but there's a couple differences. These offshoots on the side called transverse processes no longer articulate with ribs in the lumbar spine. Here, in the thoracic spine, the little spikes on the side articulate with ribs. Here they just stick off the side. And then here is the spinous process that you can see through the skin. Now let's talk about these discs a little bit. Now most of you have probably heard that these are cushions. They are cushions that allow motion between segments, but they're often referred to as cushions for the spine. And I guess am I recruiting you into my my campaign against I have a campaign against thinking of discs as cushions. I think our cushioning should be done by your diaphragms, which can act like drum heads, and so they can be very, very effective at absorbing shock, at cushioning your body. You do not want to use connective tissue as a cushion for your body. You want to do that as little as possible. And the reason for that is that they don't have blood supply. They don't heal well, and they may not even heal at all, right? So we don't want to use these as cushions. What I want to propose is that we start to think of them as a mobile squishy fulcrum. So I'm going to do a little interpretive dance to that end. Can you see my hands okay, Nate? Mm. Is this a good view? So let's think of my fingers here as spinous processes, and my fingers on the side as transverse processes. And think that there's a disc between my hands. If I flex my spine, if I bend forward, that disc slides backwards, posterior. If I extend my spine, it slides anterior. If I side bend, that disc will slide to the opposite side. The disc will always move to the best place to provide you with optimal mechanical advantage at that segment if you induce motion at that segment, right? So our next phase in trying to teach you how to induce motion at that segment is to introduce the small muscles of the spine. One of my favorite structures, some of my favorite structures in the body. So if you can come in close here, Nate. Actually, why don't we start by looking at this side. This side shows you the long muscles of the spine, the ones that go from your tail up to the top of your head. These are the ones that you work out when you go to and you do those big extensions in a Roman chair at the gym. These are the muscles that you're exercising. When you go to a CrossFit class and they want you to heave things around.
Deadlifting.
Mm-hmm. You're focused on these long muscles of the spine. But if you think about it, if you contract a muscle that goes from here to here, its job is going to be to shorten everything in between. And it's going to make that shortening happen wherever it's easiest for it to happen. So it focuses all of the motion. When you use these muscles as your primary core, if you think of these as your core and work with these as your core, you're not going to get motion of individual segments. You're going to get motion from one end to the other. And it's going to exaggerate the motion at the place that's easiest to move, which is the lumbosacral junction. Let's now go deeper. The muscles underneath these muscles over here are these muscles here. And I encourage you, we are on plate 161, and 162 of Netter. And I encourage you to all take a very close look at these and try to feel them in your own body. And just, you know, if you want to appreciate, I'll show some, Shemin, and then I'll show the inner ones here, and then you go with the multifidi and the rotatories. So there is there are two little muscles in between each one of those bumps on your back. Some of them are tiny, tiny, tiny muscles, right? So there's one on this side of the spike and one on this side of the spike. There is a little muscle between each one of the transverse processes. There's one from the spinous process to the transverse process, one segment away, and one from the spinous process to the transverse process, 2 segments away. So you can see, can you get in really close here and see this, Nate? So here's the spinous process. There it's going to the transverse process, 1 segment away. Here it is to the transverse process, 2 segments away. Here's a little muscle between each spinous process. And there you can see the muscle in between each transverse process. Okay, you want to show the other ones, Shemin?
Sure, on this side.
Yeah.
So the multifidi in general, basically you're going from spinous process down to, they go down a couple segments to a transverse process. So they kind of knit themselves like this, right? And they have, the multifidi, if you notice, have a more vertical orientation, and some of these other smaller ones kind of have more of a transverse or horizontal orientation. So the ones that have more of a transverse horizontal orientation are going to be more responsible for helping with rotation, and the ones that have a little more vertical orientation are going to be more involved with actual extension at that segment.
Right, and what I really want to point out here, if you see this like intricate array of very small muscles, is that we have in our human bodies a enormous capacity for fine motor control of our spines. Certainly a much greater degree of, we have a much greater capacity than I have achieved, is what I'm trying to point out. I think that there's so much that we can achieve by really becoming consciously competent with these small muscles of the spine, because these are the ones that are going to be able to move the segments relative to each other, not in big chunks, right? So the way we normally move when we sit up straight is we move a whole chunk of spine in one fell swoop, as opposed to moving the individual spine. And what I want to reiterate here is that these discs provide you with optimal mechanical advantage at that segment if you induce motion at that segment. That means we have over 20 opportunities for mechanical advantage in our spines, and we probably use about 5 of them. The implications for jiu-jitsu are obvious and far-reaching. Mechanical advantage is what it's all about. But even just in your activities of daily life, why put all the work on a couple segments? And lo and behold, those are the segments that tend to blow out on people, right? Because they're carrying the workload of all of these discs in just a couple segments. So this is basically our sales pitch as well for trying to get you to go in and find these small muscles of the spine. So we've got, can you pause it for a second, Nate?